At least 18 vaccine candidates are currently in clinical development, including 6 in phase 3 trials. Last week, WHO launched a new report that sets out urgent actions to ensure equitable and sustainable access to and financing for new TB vaccines when they become available. Despite all this good news, progress is not victory. TB still killed more than 1.2 million people in 2024, which for a disease that's preventable and curable is simply unconscionable. In addition, funding cuts to international aid in many low and middle-income countries threaten to reverse the hard-won gains we see in today's report. It's therefore vital that countries step up domestic resource allocation alongside international funding. One of the top 5 drivers of the TB epidemic is tobacco youth. People who smoke are twice as likely to develop TB disease. So to fight TB, we must fight tobacco. 20 years ago, the WHO Framework Convention on Tobacco Control, the FCTC, entered into force, a powerful international treaty to fight the world's leading cause of preventable death. Since the FCTC took effect, tobacco use has declined by 1/3 globally, despite the efforts of the tobacco industry to undermine it. Next week, the Conference of the Parties of the FCTC will hold its biennial meeting, and we're aware of attempts by the tobacco industry to infiltrate and undermine its work. The success of the FCTC has meant tobacco companies have had to develop new products to attract new customers. The use of nicotine products, such as e-cigarettes and nicotine patches, has expanded rapidly due to aggressive marketing with bright packaging, sweet flavors, social media influencers, and false claims of harm reduction. Let's be clear. The companies that make these products are not motivated by harm reduction or health. They're motivated by one thing and one thing only: generating profit for their shareholders. Today, WHO is publishing a new position paper on tobacco control and harm reduction. Although e-cigarettes are often promoted as safer alternatives to conventional tobacco products, there is no evidence of their net benefit for public health, but mounting evidence of their harm. WHO recommends that all countries regulate nicotine patches, e-cigarettes, heated tobacco products, and smokeless tobacco at least as strongly as they regulate conventional tobacco products. Several countries have prohibited these products. Those that have not should use strict controls on flavors, packaging, marketing and sales, protections against industry interference, and enforcement of age restrictions. We also urge governments to expand support for proven cessation methods, including counseling and approved nicotine replacement therapies. Together, we can stop another generation from being trapped in addiction and protect the gains we have made in tobacco control. Over the next few days, WHO will release several new products to support the health of women and newborns. The first is for World Diabetes Day this Friday, the 14th of November. This year, WHO has chosen the theme of diabetes across life stages, which highlights the fact that diabetes can affect people at every moment of life, including during pregnancy. Diabetes during pregnancy, or gestational diabetes, affects about 21 million women, 1 in 6 live births every year. It can cause complications including preeclampsia, stillbirth, and congenital abnormalities. Women with gestational diabetes have a higher risk of developing type 2 diabetes after childbirth, while their babies are also at increased risk of type 2 diabetes as well as obesity, cardiovascular disease, and hypertension. WHO has long had guidance on diabetes and guidance on pregnancy. But to mark World Diabetes Day, we're launching our first global guidelines for the management of diabetes during pregnancy. Second, this Saturday, the 15th of November, marks the first World Prematurity Day. Each year, an estimated 15 million babies, 1 in 10, are born too soon. 80% of them in low and middle income countries. It's vital that preterm babies receive special care and attention from the first moments after birth to preserve their lives, to give them better health throughout life. To mark the day, WHO is launching a new global guide on kangaroo mother care, a method of caring for preterm babies that involves skin-to-skin contact and breastfeeding. And third, next Monday, the 17th of November, marks the first World Cervical Cancer Elimination Day. Since we launched our global call to action on cervical cancer elimination in 2018, many countries have scaled up access to screening, treatment, and vaccines against human papillomavirus, or HPV, which causes almost all cases of cervical cancer. Just in the past year, countries including Angola, Cuba, Ghana, Indonesia, Nepal, Nigeria, Pakistan, Rwanda, South Africa, Tajikistan, and Tunisia have either introduced HPV vaccines into their routine immunization programs, or conducted large national campaigns, or adopted bold national strategies for cervical cancer elimination. This week, China became the latest country to introduce the HPV vaccine into its national immunization program. Each year, there are an estimated 150,000 new cases of cervical cancer in China, almost 1/4 of the global burden. This new policy will not only protect a generation of girls in China, it will have a major impact on the global burden of cervical cancer. Finally, as you know, the United Nations Climate Change Conference, COP30, is being held this week in Belém, Brazil. Last week, I had the opportunity to be in Belém for the COP30 Leaders Summit, where I advocated for health to be more prominent in climate change discussions. Health is the most compelling reason for climate action. But for too long, health has been a footnote in climate negotiations. It's much easier to convince people of the urgency of protecting their own health for that of their children than to protect glaciers or ecosystems. Both are important. One is a lot closer to home. Tomorrow is Health Day at COP30, and to mark the day, Brazil's Ministry of Health is launching the Belém Health Action Plan, the first international climate change adaptation plan focused exclusively on health. The action plan sets out concrete actions to help countries prepare their health systems and respond to the health impacts of climate change. I thank President Lula and Brazil for their leadership and partnership in reminding the world that the climate crisis is a health crisis. Christian, back to you.
Thank you very much, Dr. Tedros. A real big range of topics. And until then, as we're going now to question and answers, please raise your hands with the raise your hand icon. And when I turn to you, then please unmute yourself with the unmute button. Now, one important thing we have announced yesterday, we had an embargoed press briefing on the global gains in tuberculosis response that endanger future challenges or funding challenges. There's an embargo placed on this, and the embargo ends in a few minutes at 3:30 Geneva time, so literally in 8 minutes. As it was announced now, the story is open. So thank you very much for opening this, Dr. Tedros. But I would like to turn to Dr. Teresa Kasayeva just for a few words on what this report contains. Thank you.
Thank you very much. Dr. Tedros presented excellent summary of the main findings of the report, but I would like to add a few more things. So this year report is not just a release of the new latest data and overview of the global and country situation on tuberculosis. It's also a highlight WHO's unwavering commitments to continue leading efforts and fight against major epidemics such as TB, HIV, viral hepatitis, malaria, and others. And here you will be able to find also important information and lessons learned from the experience in many countries, as well as important information on the funding situation, real-time data based on monthly monitoring of TB notification, how funding cuts can influence access to essential services, as well as overview of the latest WHO guidelines and the pipeline of new diagnostic, new medicines, and even vaccines. TB response was managed for many years in the situation of the chronic underfunding, and further cuts could be really catastrophic for TB response and can lead to the increase in mortality. These gains are really hard-won gains, as Dr. Tedros highlighted, and we should do our best and increase domestic and all other types of funding to sustain TB response. That's why we are looking very much with the hope for the forthcoming global fund replenishment and for international partners and donors are stepping in. We have very good examples in more than 100 countries that managed to decrease TB incidence at least by 20%, and more than 65 countries decreased TB mortality by 35%. It highlights that progress is possible. From the century-old disease, it can become successful story, and we have a very good opportunities. Please follow WHO guidelines and latest recommendation, and it will make difference for the lives of the millions of people around the world. Thank you.
Thank you very much, Dr. Kasayeva. With this, we now, no, first of all, the report and the press release you can find online now on our website. And with this, we open the round of questions. And the first is Gabrielle Emmanuel from NPR. Gabrielle, please go ahead and unmute.
Hi, thank you so much for doing this, as always. It's really helpful. I wanted to follow up on the mention of tobacco harm reduction and see if you could respond to some of the criticism that the WHO has not fully engaged in the scientific debate around harm reduction and the reducing combustible tobacco, and some evidence that does show this reduction can have health benefits and can be a way for, not for new smokers, but for people who are already smoking to get off of combustible cigarettes. Thank you very much.
Thank you very much, Gabrielle. And we turn to Dr. Ben McGrady. He's the unit head of the Tobacco Free Initiative here at WHO.
Thanks very much. And just to clarify, actually, head of the public health law work on tobacco control, and my colleague Vinayak Prasad, who heads the Tobacco Free Initiative, can't be here today. Thanks very much for the question. I think it's important, first of all, when we consider tobacco control and this question around combustibles, to think about the bigger picture of where we are on tobacco control. Dr. Tedros mentioned that it's 20 years since the Framework Convention on Tobacco Control came into force. And in that 20 years, with strong regulation of tobacco products, we've seen enormous public health gains. We've seen a 27% relative reduction in tobacco use globally since 2010. So when we look at tobacco control, we need to look at the big picture and we need to know what's working. And the evidence shows that over a sustained period of time, strong regulations to reduce demand and supply for tobacco products is having a massive impact on public health, and that impact is a huge public health success. With respect to so-called non-combustible tobacco products, and we're speaking here about a range of different product categories, it's important to recognise that we cannot generalise about the health risks posed by these tobacco products for the world at large. Even within smaller product categories like electronic cigarettes or heated tobacco products, the risks posed by individual products are not the same. We see huge variation within product categories. We see huge variation in terms of how the products are used, how the products are manipulated before use. And so it's not responsible to simply generalise for the world at large about the health risks associated with different products. What we're stressing in the position that we are releasing today is that governments should regulate all categories of tobacco, nicotine and related products to a common minimal level. This means implementing proven tobacco control measures like health warnings, like taxation, like prohibiting advertising, promotion and sponsorship for all categories of products. This is essential to ensure that when we look at the population at large and the health of the population at large, these products do not lead to a new generation of addicts, nicotine and tobacco addicts, and a new generation and wave of health harms. It's essential that these measures are put in place across all product categories to protect public health. Thank you.
Thank you very much, Ben. Yeah, quick reminder, because apparently a couple of journalists have not identified themselves with their outlet. So please do that, your full name and outlet, in case you want to jump online and ask a question. Otherwise, we cannot take you. Thank you very much. Second question goes to AFP, Robin Millar. Robin, please go ahead.
Thank you. On the tobacco industry and those attempts to, as you put it, infiltrate and undermine the convention's work, could you say a bit more about what sort of things they've been getting up to, and also on this use of social media to promote products? Can you give us a few insights on what's been happening in that field as well? Thank you.
Thank you very much, and over to Ben again.
Thanks, Christian. I think the social media point is a really important one, and WHO has now for a number of years advocated comprehensive bans on tobacco advertising, promotion and sponsorship. That means that all forms of advertising, promotion and sponsorship should be prohibited, and this should be applied not just to tobacco products, but also to nicotine products such as electronic cigarettes or nicotine pouches. We've seen over the last 10 years, tobacco and other companies launch new products and new product categories on social media. Social media platforms are spaces in which children and young people shape their identities. And these companies are deliberately using these spaces and promoting products with fruity and sweet flavours, with bright colours and with other product characteristics that are particularly attractive to children and young people, in order to bring those products into the market, in order to sustain their businesses and sustain their profits. So it's no surprise that we as an organisation recommend that governments take a very strong approach to legislating to prohibit this, to monitoring what's online, and also to enforcing those restrictions. This is particularly important, we've seen over the last few years, with new product categories like electronic cigarettes that have led to an alarming rise in youth among children. What's the industry doing? It's lobbying like crazy at present around its so-called harm reduction agenda. And the industry is particularly focused on trying to sow division and to sow a narrative that these new categories of products are reduced harm products. But the reality of the situation is that these products are being marketed as consumer products to the world at large. And as I've already said, they have sweet flavours, they have bright colours, they have characteristics that are specifically attractive to children and young people. This is not public health harm reduction. This is uncontrolled, this is not pursuing a public health agenda, and this is not monitored with public health goals in mind. Thanks very much.
Thank you very much, Ben, and a good moment to remind everyone that tomorrow at, I think at 3 o'clock, the WHO Framework Convention for Tobacco Control, FCTC, had a press conference where you could also tune in virtually. Thank you. Next question goes to Geneva Health Files, Priti Patnaik. Priti, please go ahead.
Good afternoon. Thanks for taking my question. We wanted to know about any preliminary assessment that WHO has done on the US bilateral contracts with certain developing countries on accessing biological information in exchange for aid. There is apprehension that this could directly affect the pathogen access benefit sharing negotiations at WHO and the wider PPR agenda. If you are able to comment on this, that'll be great. Thank you.
Thank you, Priti. And I think we have Steve Solomon, our principal legal officer online. Steve, if you're there, please go ahead.
Yeah, thank you, Christian, and thank you, Priti, for the question. This issue of the U.S. initiative in this area came up during the most recent session of the Intergovernmental Working Group, IGWIG 3, as we're calling it. I'm sorry, I'm out of focus here. The member states are closely following this issue. The organization, the Secretariat, is working to support member states in that, and we will continue to follow these developments, ensuring that the work of multilateral, fair, equitable access and benefit sharing system is advanced in accordance with the Pandemic Agreement and its Article 12, which was adopted by the World Health Assembly, is critical for the organization and for its member states. The objective is to deliver a multilateral pathogen access and benefit sharing system to the Health Assembly in May of next year for its approval, so that the Pandemic Agreement and this system, which will ensure better access in the face of future pandemics to vaccines, therapeutics, and diagnostics. This is critical for the organization and its member states. And so we will continue to work in that connection.
Thank you very much, Steve. Next question for NBC News, and that's Erica Edwards. Erica, please go ahead.
Can you hear me okay?
All good.
Thank you so much. So my name is Erica Edwards. I'm with NBC News, and I'm wondering if someone could please speak about H3N2, which is getting a lot of headlines from the UK and Canada. Apparently a worrisome strain of the flu circulating early. The CDC here in the US isn't releasing any information about the flu because of the shutdown and so many layoffs at the agency. And I'm curious whether WHO can provide any insights into the spread of this particular flu and what it might mean for the US. Thank you.
Thank you for this, Erica. And we have Dr. Wenjing Zhang. She's unit head for our Global Respiratory Threats Unit. And Wenjing, please go ahead.
Thank you, Chris, and thanks very much for the question. So now we are in November. Actually, for the Northern Hemisphere, we are about to enter into the winter season. And often, this is a season for seasonal influenza epidemics occurring. And for many countries, or for almost all countries, that the timing of start of the season could be varying, but always around this period of time. So in the past several weeks, there were many countries having reporting that their influenza season started. But if we look at historical record of the timing of the start of the season, actually it is not unusual. And your question about the specific H3N2 strain recently reported from UK. So actually H3N2, this is a seasonal strain, and this is one of the several strains like H1N1, H3N2, and E strains circulating and causing seasonal epidemics. That particular strain, and it is named clade or subclade K, this is a small group that emerged since June. And since it's emerged, it's rapidly spreading and predominating in some countries so far in the Northern Hemisphere. So it comes again to the vaccine composition, that the vaccines are being used in the Northern Hemisphere now. This composition was recommended in February this year, basically before the emerge of this particular small group of those. Fortunately, from the early studies, the early estimates from UK, the vaccine effectiveness studies, actually the VE estimates is quite normal or satisfactory, that in the children it's 60 to 70%, and in the adult is around 40% of those. So although the current vaccine composition and the emerged clade of the virus is not optimally cross-reactive, still the vaccines can provide the protection of those. Your another question is about the vaccination policy in countries in US, and it's always national authorities, regulatory agencies, and authority, recommend their vaccination policies in their country. And from WHO, the SAGE group, the Scientific Advisory Group for Immunization, actually highlight the risk groups recommended for receiving seasonal vaccines, and that includes like healthcare workers, people with underlying conditions, pregnant women, and the older adults, indeed. So this position remains the same, and with the winter season upcoming, certainly we recommend all those, especially those under the risk groups, get vaccinated.
Thank you very much, Wenjing. Now we come to the next question for Ali Withers from Reuters. Ali, please go ahead.
Hi there. Hi, thank you for doing this briefing. My question is for Dr. Tedros, please, regarding COP30. Earlier in this briefing, and there was already a question about it, there was the mention of how the tobacco industry is infiltrating a different multilateral forum. There's there's documentation of a lot of fossil fuel lobbyists being present at the COP. I'm wondering if there's a view on addressing fossil fuels within the work in health, because it's the leading contributor of air pollution, extreme heat deaths, and so on, and if there's work happening at the WHO on this level, or a position or a statement, please.
Yeah, if I may, I could answer this question. Thank you very much for it. Now, of course, there is a need to step out of fossil fuels, and I think that in this COP30, there will be more efforts to reduce fossil fuels. So, as we said, and as Dr. Tedros said, the climate crisis is a health crisis. And so therefore, we need more action and more implementation. We need to go through to renewable energies which are available and effective and efficient, and can create a lot of business as well. So while we have seen a lot of health negotiation or health discussions at the COP, we have not yet seen a formal place for negotiations of health. And what we see from Belém just now, following the discussions there, it is high time that health becomes an issue for formal negotiations, and we hope to see this already at COP31. Thank you.
Thank you very much, Rüdiger. Next question goes to Christiane Oelrich from the DPA. Christiane, hello, and please unmute.
Danke, Christian. My question is going back to tobacco. An expert paper that is to be presented at the COP has measures for the future on how to effectively fight tobacco, and it has suggestions that have kicked up some storm, at least in the German media, about banning filters for cigarettes. I already talked to Ben about that, but I wonder whether WHO has a more of a political answer to this question. Are these suggestions are considered as extreme in some quarters? Is it maybe not very beneficial to come up with something where a lot of people who are basically agreeing that more tobacco control is necessary would say, well, this goes way too far and diverts from the actual issue of taxation and so on? I wonder whether Rüdiger might be able to answer this, because I know that he's the tobacco specialist from only a few months ago. Thank you very much.
Thank you very much. And actually, your question is related not only to tobacco control, but also to the Plastics Treaty. And here we have a very strong stand. We do believe that it is high time to ban those plastics because we don't see the health benefits of plastic filters. We see that this is or has been the same tactics of tobacco industry to say, well, filter cigarettes are less harmful. It goes back to the same argument that Dr. McGrady has made just earlier. And we do not see the health benefits of these filters. So therefore, they must be banned because they are the highest pollutants in waters, in oceans, of these plastics that are contaminated also with toxicants. So therefore, yes, we do call for banning these filters.
Let me see if anybody wants to add anything. Oh yeah, Dr. McGrady.
Thanks, Christian. Yeah, just to add to the comment from Rüdiger and answer the question, Christian, about whether countries should be prioritizing the ban of filters or other measures. First of all, when we think of tobacco control, we think of a comprehensive set of interventions that governments take to reduce demand and supply. So it's not an either or. Governments need to take different interventions that complement one another to achieve the goal. I think we are eagerly anticipating a proposal from the European Commission for revision of the EU Tobacco Products Directive. And there are a number of different ways in which Germany and countries in Europe can further strengthen their tobacco control laws. One of the issues that we're talking about today are some of the newer generation products, electronic cigarettes, nicotine pouches, heated tobacco products. These were not addressed in detail in the 2014 EU Tobacco Products Directive, and we would encourage the European Commission and EU member states to strengthen their regulation of these products and take the opportunity of a revised directive to do so. We think that they can make substantial progress in tobacco control and address what is a serious issue now of use of these products by children. And just to give you one statistic on this, when we talk about e-cigarettes, the latest data that we have shows there are 15 million children worldwide using e-cigarettes. And in countries that have data, we see use rates among children 9 times higher than among adults. It's clear that it's time for Germany, for the EU member states, and for countries at large to take strong action to address these products. Thank you.
Thank you very much, Ben. And this brings us to the end of our briefing. I thank you all very much, and I thank the panelists here and those online. We will send the post-presser remarks and Dr. Tedros' opening remarks very soon after the briefing. And with this, back to Dr. Tedros for closing.
So thank you very much again to the press for joining us today, and see you next time.